Good afternoon. My name is Joey Thurgood, and I am the Adverse Childhood Experiences Prevention Specialist for the Department of Health and Human Services. I'm really pleased to have an opportunity to come and speak to you today. Before I start, I'd like to tell you a story. Imagine, if you will, close your eyes if you need to. Imagine yourself sitting on the edge of a beautiful river. You and a friend enjoying a nice picnic. The sun is out, the sky is clear, it's a beautiful day. And suddenly out of nowhere, you hear splashing and thrashing in the water, and you realize someone has fallen in. And so as you run over to the edge of the river, you see a child, and this child is fighting to stay above water and screaming for help. And so you jump into the water to pull the child from the water out of the current and to the shore. And as you're working on the child to make sure that they can breathe and that they're okay, you hear another splashing sound. And you look upstream, and before you know it, here comes another child. So your other friend, they jump in and they pull that child out. And you're both working on comforting and making sure these children are okay and that they're breathing all right when you hear yet another splashing sound. And you're becoming exhausted as one of you jumps in to grab that child. And finally, you turn to your friend and you say, "I'm tired. I can't keep doing this. Someone has got to go upstream and figure out who's throwing these children in the water." This analogy is often used in primary prevention. When we talk about primary prevention, we're talking about the importance of investing early in prevention. We know when we invest early by reducing risk and by improving outcomes across the lifespan, that we can change that individual, and not just that individual's outcomes, but the outcomes of their posterity throughout generations. Today, we're going to talk about 3 things that are important to primary prevention. The first is something called shared risk and protective factors. The second is called social determinants of health. And the third is called the 2-generation approach. All of these 3 points work together to create a safety net that can help children and families see better outcomes across their lifespans. Now, most of us in our lives have one risk factor or another that put us at risk for certain outcomes. Maybe you experienced adversity in childhood. Public health science shows us that unmitigated risk factors, meaning that there's not a protective factor that mitigates and takes down the damage that risk factor can do, can often lead to poor health and opportunity outcomes across the lifespan, and not just across that one individual's lifespan, but across generations. What we do know is that early adversity, or what is sometimes referred to as adverse childhood experiences, can lead to higher risk for poor health and opportunity outcomes. We know that those risks can include things such as higher risk for suicide, a higher likelihood of experiencing substance use disorder, or engaging in risky behaviors such as early initiation of sexual activity or promiscuity, and also can lead to physical illness that can shorten life. We also know that risk factors, when unmitigated by a protective factor, can lead to higher risk for crime victimization, such as child abuse, domestic violence, or even community crime, and can even lead to higher risk of crime perpetration. People who have experienced risk in their lives oftentimes end up thinking the only way to protect themselves is to act out first. And so that leads to crime perpetration. But just because you have high risk factors doesn't mean you're doomed. Risk factors can be countered by protective factors. Protective factors are things that provide you a buffer against a risk factor. In fact, one of the most influential risk factors that we can think of when it comes to youth, and that science has borne out, is that having just one supportive adult outside of the home, whether it be a teacher or a clergy or your best friend's mom, can have extreme benefits for that child and mitigate those early childhood adversities that they're experiencing within their home or within their life. When we talk about early adversity, we aren't just talking about child abuse or neglect. We're talking about the conditions in the places where we live, work, learn, play, and worship. Those are called the social determinants of health. They're factors outside of access to healthcare. Now, access to healthcare is one of the social determinants of health, but there are others that include economic stability, access to quality education, access to healthcare, as I mentioned, safe and healthy neighborhoods, and social and community context. But for the purposes of today's discussion, we're going to focus on two, the first of which is economic stability. It doesn't take a genius or a whole lot of scientific research to realize that when you have poor economic stability, you're going to have poor outcomes, such as homelessness, housing insecurity, food insecurity, and uncontrolled chronic health conditions because you can't access the medications or the treatments that you need in order to be healthy. These are all connected to poor economic stability. Now, in the mid-1970s, a tax program was put in place to address economic instability, and it's one you've probably heard of. It is called the Federal Earned Income Tax Credit. The Federal Earned Income Tax Credit has been a great success over its many years of implementation and has bipartisan support. But the problem that we find in Utah is that there are a lot of people who are eligible for the Earned Income Tax Credit who simply do not access it. There are challenges to uptake, and we're still trying to figure out what those are. But if we can encourage people to file for their taxes and access those additional credits, federal earned income tax credits, the child tax credit, other dependent care credits, and even stimulus payments from during the COVID pandemic, that is additional finance into their home and into their communities that can help them buy food, that can help them pay their rent or get a car repaired or go back to school to improve their long-term economic health. The second social determinant of health that we're going to discuss today is social and community context. A meta-analysis of studies has shown that the damage done to your health by social isolation is about the same as the damage done to your health by smoking 15 cigarettes a day. You can die earlier than you should if you're experiencing unmitigated social isolation. So social connections are extremely important, not just to children, but to adults as well. And one of the reasons for this, there are many reasons, but just one of those is that socially isolated people, they're less likely to seek help when they need it. They're less likely to go to a therapist when they're having a mental health crisis. They're less likely to apply for state subsidies for housing or for food stamps because they aren't connected enough to know how to access those resources. So it's important that we address these social determinants of health in order to ensure better outcomes for both children and families. We can't just fix this by focusing just on parents. And we can't fix this by focusing just on the children. We have to address both sides in order to have success. So the most successful approach that we have found within public health is called the two-generation approach. The two-generation approach supports both parent and child. We recognize that when a parent is experiencing social isolation, their child is likely experiencing social isolation as well. We recognize when a parent is experiencing economic instability that it is impacting the child as well. We know that parents who recognize that they have shortcomings and are willing to ask for help are more likely to have good outcomes. And we know that children raised by parents who are willing to seek help are more likely to seek help when they need it too. This can break down generations of isolation that prevents good mental health, good physical health, and good community health. The two-generation approach benefits all of society, not just the family that we're talking about or trying to help. Because a supportive, well-connected parent today equals a healthy, robust workforce and community. And a healthy, robust, connected, supported parents help shape that workforce of the future by raising well-connected, well-supported children who grow up to be that robust workforce. So if you have risk factors, and most of us do, or if you struggle with some of the different social determinants of health, all is not lost. Early intervention pays off in healthy communities, stronger workforces, and happier and healthier families. As I mentioned before in the beginning, when we invest early in children and families, we are reducing risk by improving outcomes across the lifespan and by breaking up that intergenerational transmission of those traumas and adversities. We are breaking the chains of the past for families and children. Many of us have risk factors, but they can be mitigated through protective factors. We know that the social determinants of health, like economic stability and social and community context, are just as important to good health outcomes as access to health care. And we also know to have our greatest impact, we must focus on both parents and their children so that we can ensure healthy families now and a healthy future. So just remember that river analogy at the beginning and help us build fences around the up above where those children were falling in, instead of constantly having to fish those kids out of danger. If we build fences, we're building a more protective, healthy future for ourselves, for our community, and for society as a whole. Thank you so much for listening.